Whether you have a diagnosis or not, I don't care. Jump inside this podcast and I'm going to teach you how to read your own blood work so you can find the answers to your health concerns. Yes, those normal labs that your doctor keeps saying, oh, they look great, we'll see you again in 6 months. They really have answers in them if you know how to read it correctly. So come join me along this journey, leave a review, and share with your friends. Let's dive in. Welcome to the Beyond the Diagnosis podcast with me, your host, Dr. Kylie. Today it's just me, and I haven't done one of these in a long time, so I wanted to do this right here, right now for you, because I opened up a new opportunity, a way for you to not only get me to personally read your blood work, but then to create that personalized treatment plan in which you then get to go execute, and all of it comes together in one package. So you get my lab reading, you get the lab interpretation, plus the personalized plan, plus those supplements that are included in those personalized plans. And we've had a handful of people jump in as I've introduced this new program to the email list and social media. So if you haven't joined me there, come join me. You can find me at Dr. Kylie Burton on Instagram and Facebook. And that way you can stay up to date. I record these episodes months and months in advance. So they're not always the most up-to-date and current on what offerings are available, what programs are available. So be sure if you haven't joined me yet on social media to do so, whether you're a patient or a practitioner, come join me. Dr. Kylie Burton on Instagram and Facebook. Yeah, you can find me on TikTok, but that's just such a negative energy platform for me that I haven't gotten myself to go back on it yet. And it's been months, like 6, 7, 8 months. Even though I have like an 80,000 member following and I have accumulated in like 4 months. It's all right. We do things for a reason. So on this podcast episode, we're going to talk about fixing your messed up gut. And I'm going to use a case scenario to do this. We're going to jump into some labs, which like I said, we haven't done it for a while, but this gut stuff, I get messages of people sending me TikTok videos and reels of people complaining about their gut and getting told they have IBS or IBD and they're just on some medication that hasn't solved anything for them. And in this perfect scenario with this specific client that we're going to dive into her labs, she's tried some functional medicine beforehand and it was all hormones. They solely focused on hormones. And I was like, did they ask you anything about your gut and your digestion? Well, no, because we just were focusing on my hormones. And menopause, that was the big thing. Yeah, I missed a big piece of the puzzle. Because as I started to talk to her about her digestive tract, she has a lot of digestive issues. If you have digestive issues, you got to tackle these guys first. And going to a gastroenterologist might be the best route for you, but there are other ways. And if you're listening to this podcast, you probably know that there are other ways. So on Fix Your Messed Up Gut Part 1 here, we're going to jump into these labs and what they say and what it means for her gut. And then in Part 2, we're going to go into what to do about it. Okay, so if you have a messed up gut, if you know somebody who has a messed up gut, tell them to come listen to this podcast episode and the next one so that they can get a true idea of what's going on and how we can solve it using the blood work you already have. So, yeah, I don't know if I've ever shared my screen on this platform before. So, okay. I want to show you, if you're looking at this on video, you can find it on video on the YouTube, but this is a questionnaire that I often recommend for people who want me to read their blood work, because I want to know not only what the numbers say, but how do you feel? And as you can see, there's a lot of zeros and ones. That's a good thing. That means those symptoms aren't a concern. We do have a 4, which is the highest number on this questionnaire. It means it's severe and frequent on chronic coughing, rapid or pounding heartbeat, and chest pain. But let's scroll down here to the digestive tract section. We have a 0, a 4, 4, 4, 4, 4, and a 1. A 4 on diarrhea, 4 on constipation, 4 on bloated feeling, 4 on belching, passing gas, 4 on heartburn, 1 on intestinal stomach or pain, and 0 on nausea and vomiting. So a total of 21 points in just that one section. Then we get to the weight, and it's craving certain foods, excessive weight, water retention, all of those are 4s. We got some major fatigue, mood swings, anxiety, all of those are 4s. And yet, no one's bothered checking out her digestive tract. The entire time she's been through multiple naturopaths, multiple functional medicine doctors, and in her mid-60s, she's just about to give up. The symptoms here, where do you begin? When you have all of these symptoms, it's always a fun one to think, where do you begin? And in my 5-step treatment plan, if you've been around for a little while, if you haven't, it's a 5-step treatment plan where we begin with support, making sure the body has what it needs, specifically vitamin D and iron. And then we get into the gut. And we got to figure out what's happening inside the gut, because we've got a lot of symptoms going on in there. A lot of bouncing back between chronic diarrhea, chronic constipation, bloating, belching, heartburn. And this isn't just, guys, I've seen TikTok videos of people sending me these videos of teenagers and young women and people in their 20s, 30s, 40s. Like, this is not exclusive to just a certain age group. It is happening in everybody. People have messed up guts. And it's not their fault. It's not your fault. It's the fact that we live in the environment we live in. Okay, so here are her symptoms as we've just covered them. Then we want to go into her blood work. And if you're watching this on video through YouTube, awesome. If you're not listening, you're just listening to audio, that's okay. I'm going to walk you through it all. But this blood work form is something that I have utilized in all clients and all lab interpretations. And if you're a practitioner, I give you this form inside the workshop or our 90-day program. If you are a patient, you can actually access this form inside the brand new Everything You Need to Know About Blood Works course, in which you will learn how to read your own blood work in less than 2 hours. It's pretty powerful. Not only read your own blood work, but then know what to do about it. So the next time your doctor says that your labs are normal, you can get them in your possession and smile and say thank you and go home and read them the right way. Okay? Now I get a lot of questions about where do these... I don't get questions because I tell you them, but I get practitioners who are trying to explain this to their patients who are then like, how do you explain this? Because they don't know where this is coming from. I literally answered an email with that question this morning. If you are a practitioner trying to explain this to your patients, say it like this. The difference between the normal range and the functional range is that normal ranges are large, and they're comparing your healthy status to someone who's sick in the area, but just, doesn't have a diagnosis, so deems they're healthy. 2, the normal lab ranges are trying to trying to find your favorite restaurant somewhere between California and New York. Good luck. And 3, I didn't come up with these ranges. A doctor by the name of Dr. Datis Karazian, he's one of those guys that has 9 million letters next to his name. Someone had to do the research and come up with them. He did it, and he and his team did it like 25, 30 years ago. And I've been using them, but because I have thousands of labs that I've seen with my own experience, I've tweaked them somewhat. Okay, so that's where these things come from. Next up, is these are ranges that are not normal ranges. These are functional ranges. That means that we've taken the normal range and made it smaller. So now if you fall outside of the functional range, now you don't feel good. Not bad enough to elicit a positive test result or diagnosis, but you still don't feel good. Okay? So that's kind of the background, especially if you're new to this podcast. I'm really big on labs. I love numbers because numbers never lie, but you gotta read them correctly. Okay. Jumping right in, we're just going to go from top to bottom with her labs, and then we'll get to, on the next episode, what do we do about it? But remember, our gut's important. It's just one piece, one system of the body. So we have 4 different lab markers for glucose, and that is the amount of sugar in your blood. I like to see it between 85 and 99. This particular patient, her results are 108, 93, 131, and 86. So they're up and down, back and forth, up and down. If you have unstabilized blood sugar, it's going to lead to hormone chaos. Now remember, she's tried hormone therapy with a functional medicine practitioner before, didn't get anywhere with it. Now, hormone chaos, the underlying cause is blood sugar. And if you listen to the last episode, I go into those 3 requirements to balance hormones, and that's one of them. Her hemoglobin A1C is at 6.2, which what that is, it's a long-term blood sugar. So your blood sugar over the last 3 months, it's at 6.2, which isn't terrible, but we don't want it to go any higher. We want it to stabilize and come back down. BUN is a kidney marker, and since hers is at 12, 13, and 11, we're going to look into the need for hydrochloric acid, which is an acid inside your stomach. If you have too little of it, yes, I said too little, it's going to lead to acid reflux, GERD, heartburn, all the same thing. Okay. I see some sodium and potassium markers outside of the range here. So we're going to have adrenal fatigue as a big piece of our puzzle. Now remember, all of these lab pieces or markers are just pieces of the puzzle. So the more pieces of the puzzle you have, the better your puzzle, the more complete your puzzle is. Chloride is slightly elevated. Chloride is a kidney or a detox system marker. And then we have down here calcium. We've got the range is 9.2 to 10, the functional range that is. She's sitting at 9.3, 9.2, 9.2, and 9.1. And that is a direct correlation of needing vitamin D. I don't know if we have a vitamin D on here yet. We'll see. But if she doesn't, I at least know based off her calcium levels, we got to jack that vitamin D up. Okay. Total protein and globulin here tell me that leaky gut is a major problem. Total bilirubin is good. Alk-Phos is elevated. And when Alk-Phos is elevated, we're looking at liver or the detox system. Okay, same thing here when we've got an elevated AST and ALT. And by elevated, I mean over 26. Those are liver markers. But more importantly, for me, it's like an assessment of how is the detox system handling the load. And by these labs, we're struggling to handle the load. No iron panel, which sucks because we need to know what our iron status is. But since she's postmenopausal, I would imagine it's okay. Cholesterol is at 181, triglycerides at 106, HDL at 40, LDL's at 120. When I see low healthy fats, like low HDLs, I'm going to say need healthy fats. Then we get into the thyroid marker here. Thyroid TSH looks great. Free T3 is low, then it's okay. Free T4 is good. No antibodies tested. So if a low free T3, we're looking at gut and the liver because it's got to get converted in those two places. Vitamin D is at 64 and 58, so not bad. Okay, here's the fun stuff. If you've been around me, you know I love the CBC with differential because this is where we get into the details about the gut. And if you haven't seen this on video, you need to go check it out on YouTube at my page. I don't even know what the page is called, honestly. Beyond the Diagnosis with Dr. Kylie, try that. But we're looking at a white blood cell count of 13.1, 10.5, and 11. The healthy range the functional range is 5 to 8. So that is all quite high, meaning we're going to have some type of infection. And then I'm going to jump straight down to figure out what type of infection that is. And with the neutrophil count at 75, 55, and 67, we're finding some bacterial infections. Whenever I fight bacterial, I'm always going to treat fungal. Lymphocytes are depressed, which isn't surprising because the neutrophil count is so high. Monocytes are elevated, so now we've got some viral infections as well, which those are your most popular 3 combinations. Very rarely will you see one. Maybe you will see one, but you're going to treat multiple because they like to hang out together. So to fix her gut, we're going to fix the bacterial, fungal, and viral infection. And just watch as we do that with natural supplements, the right ones and the right dose and the right quantities and the right timing of the day. Her major gut symptoms are just going to go regular bowel movements, decrease the bloating, being able to eat normal food and not have major repercussions from it for days on end, all because of what her normal blood work told me. Okay, scrolling back up here to the red blood cell count, which is elevated. So I'm going to add in some B vitamin methylation, which means we need to help her body utilize the B vitamins she's eating. We got a lot of these ones, actually. In fact, all of them. It's been a while since I've seen all of them. This will be a fun set of labs to teach practitioners. We do have some low markers as well, so possible iron. Okay, cool. So I'm going to scroll back through the blood work and just remind you of everything that I found inside her normal blood work. Blood sugar unbalanced leads to hormone chaos. Possible need for hydrochloric acid. Knowing how many gut symptoms she has, I would imagine that's a big component. Adrenal fatigue. 1 kidney marker's off, meaning the detox system. The leaky gut markers, all 3 of them are off. 1 marker, well, no, actually 3 markers for the liver, which is part of the detox system. Cholesterol panel tells me we need more healthy fats to help out those hormones. Thyroid tells me we've got some gut and liver issues, which kind of already knew that. Vitamin D is good. And then we're fighting some bacterial, fungal, viral infections. In addition, we need to support her body's ability to utilize B vitamins. And we get down here into some extra notes, and we have some FSH, some estradiol, vitamin B12, and folate. B12 is at 477, folate's at 6.2. Just knowing off the top of my head what those should be at, they're on the lower end. So I'm not going to give her B vitamins. I'm going to give her bodies the ingredients it needs to utilize those B vitamins. The FSH and the estradiol are pointless because we don't know what's happening in the endocrine system. We only have one piece of the puzzle. We need more pieces of the puzzle. But I also know that when we fix everything else, the endocrine system is going to do a lot better on its own. All right. Okay, I hope that worked with the screen sharing and everything if you were watching the video. That's a lot. Found inside regular blood work that she already had from her doctors, multiple different labs taken over the last 3 years to try to figure out these health concerns, and was told that they were normal. So now you know what can be found inside your blood work and what leads to messed up guts. What do we do about it? Stay tuned for the next episode. Ready to have all of your blood work compiled in one location where you can easily read it all together? Well, go grab my book, Why Are My Labs Normal, on Amazon. Grab it, learn how to read your own labs, and take the power back in your hands, because your normal blood work is loaded with answers. You just got to have the right person reading it, and the right person can be you. Go grab it on Amazon, Why Are My Labs Normal by Dr. Kylie Burton. Leave a review, and we'll see you on the next episode.